Next, ensuring accurate and compliant coding. Introduction. Accurate and compliant coding is essential for fair reimbursement, legal adherence, and maintaining the integrity of healthcare records. This module focuses on strategies and best practices to ensure coding accuracy while complying with industry standards, regulations, and guidelines. Next, importance of accurate coding, proper reimbursement. Correct codes ensure providers receive appropriate payment for services rendered. Next, legal and regulatory compliance. Adherence to guidelines prevents fraud and avoids legal penalties. Next, reliable data. Accurate codes support quality reporting, research, and health statistics. Audit readiness. Precise coding reduces audit risk and enhances organizational credibility. Next, best practices for accurate coding, thorough documentation review. Always base codes on complete, detailed, and clear clinical documentation. Use official guidelines. Now follow coding manuals for ICD, CPT, and HCPCS and official coding conventions. Next, regular updates and continuing education. Stay current with code changes, updates, and industry regulations. Next, double check. Cross verify codes, especially when multiple codes are involved or when modifiers are used. Coding conventions and guidelines. Official coding guidelines. Refer to guidelines provided by CMS, AMA, and AHIMA. Sequencing rules. Know how to order primary and secondary codes correctly. Next, use of modifiers. Appropriately apply modifiers to convey additional services details. Inclusion and exclusion notes. Follow specific rules to include or exclude certain codes for accuracy. Next, common pitfalls and how to avoid them. Upcoding. Assigning more severe or more extensive codes than supported by documentation. Unbundling. Separate billing for procedures that should be billed as a single package. Overlooking updates. Using outdated codes from previous years. Ignoring documentation gaps. Coding without adequate documentation leads to errors and audits. Next, tools and resources for compliance. Official coding manuals such as ICD-10, CM, and PCS, CPT, and HCPCS publications. Coding software. These include electronic tools that help validate and cross-check codes. Next, audits and reviews. Regular internal audits to identify and correct errors. Training and education. These include ongoing training sessions, webinars, and industry updates. Next, summary. Ensuring accurate and compliant coding is a cornerstone of ethical healthcare billing. It requires diligent documentation review, adherence to official guidelines, continuous education, and internal quality checks. Mastering these practices minimizes errors, prevents fraud, secures appropriate reimbursement, and sustains organizational integrity. Thank you.